According to the American Psychiatric Association, only 1 in 20 Hispanics or Latinos receive mental health services from a mental health specialist. Joining me in the studio today are Dr. Virmarit Davila-Sanchez, Clinical Supervisor and Program Manager at River Valley Counseling, and Dr. Madeline Aviles-Hernandez, Division Director of Outpatient and Recovery Services at the Gandara Center, to help us understand how mental health is affecting the community and what services exist to encourage more people to seek assistance from professionals when needed. Mental health is something that can affect anybody, but can you specifically talk to me about how it's affecting the Latino community?
Well, one of the things that we have to remember about mental health is just that it doesn't discriminate. It can affect anybody. But in our community, we see mental health, we see a lot of our individuals facing a lot of challenges, issues related to community violence, substance use disorders, trauma. So we see that a lot in the individuals that we serve and in our community as a whole.
Are there any stigmas related to mental health in the Latino community?
Basically, the fact of not seeking for services due to the mentality of relating the term of craziness to looking for behavioral health services. So I think that's still a stigma that it's very, very present in our community. It's something that us as providers have to work and explain to them that it's not necessarily in that state. Even that word is not used anymore. So try to explain to them that it's okay for them to look for services. It's still a challenge, but yet they still come and get the services that they might need.
You mentioned being called crazy, if you're looking for services. Do you think that Latinos downplay some symptoms? Like, for example, if they're having anxiety, it's like, oh, solamente fue un ataque de nervios or algo así. Is that something that you see Latinos doing?
They can, yeah, and they do. But what we also see is at times they don't even know how to recognize those symptoms. So they don't even know necessarily what depression looks like or what anxiety truly looks like or what are the symptoms of somebody that's been exposed to trauma, PTSD, things like that. So oftentimes, yes, they may downplay them, but a lot of other times it's just that they don't know how to recognize them.
What are some of the services that local organizations have to offer for Latinos?
Well, for example, in our community, we have different clinics all around the Hampden County. Specifically in the Holyoke area, where River Valley Counseling Center has been since 1953, we have provided services for outpatient outpatient clients, mostly within either English or Spanish, all types of populations, children, adolescents, and adults. One of the services that we also provide is, for example, if children are needed of services, there are certain schools that we have identified in the Chicopee, Holyoke, and East Hampton area that we provide the services in the school. So there's a big variety of services that we provide additional to in conjunction with the Holyoke Medical Center, which we became an affiliated in 1986. We provide services within the medical offices. Also within the weight management program, we also have clinicians there. We have been in the community in Springfield for our HIV program, which provides services with case management and housing for clients who have been identified as HIV. So there's a variety of programs that here in the community that we have been able to provide, and most of them are focused on treating the Latino population, since we have seen a lot of migration from Puerto Rico and other places that they provide or that they need the services to be in Spanish for them to be seen for behavioral health.
My colleague Will said that is something that we see a lot. And in fact, for our agency, that's been our specialty. We treat, and the population that we focus on is minorities, is the Latino population, individuals in underserved communities. And like she very well said, we in our case, Gandara Center, we're all over the state. So we have recovery centers, we have clinics, we have different programs, residential prevention programs, and they're all over the state. And something that we're very happy that we have within our doors and in our clinics is all of our clinicians are bilingual, bicultural. So that is something that for us is very, very important. Not only that we're able to provide services in that native language, but also that our staff also resembles that community, that are able to speak that language, that comes from neighborhoods maybe that our same individuals come from, that are able to relate to that culture, to that to those raíces. So that is something that we very much focus on, and that we are that it's very much in all of the services that we provide.
Have you seen the difference in the community for them having these resources available, not only in their language, but also that cultural connection that they have?
Oh, absolutely.
Definitely.
Yes, I think that we can both agree. Just, I mean, even for I speak for myself, but I would say that just going to someone that speaks your same language, that is able to understand where you come from, that is able to pick up on the nuances in language or gestures or body language, things like that. That's very important, and that is certainly something that our communities really does look for, and I think that they appreciate that very much. The fact that they have someone that looks like them, that is able to understand where they're coming from, that speaks their language. That is very, very important. Absolutely.
Also the matter of feeling that they have like an extended person that they can go to, because most of the families, when they come due to a fact of improving themselves or kind of looking for a change. So sometimes the behavioral health clinics have been that first go-to in terms of knowing the system and being able to accommodate themselves. And when they see a clinician and even a staff of our office that speaks the same language, they have that sense of being welcomed and that sense of being in a safe place, that they know that they're going to be taken care of in a proper and in a respectful way in order for them to feel comfortable and feel accepted.
Mm-hmm. And I know Latinos sometimes have that wall up with strangers, right? How do you work to break down those barriers and make them feel more comfortable in talking to you as a stranger?
In the matter of that, I think it's the issue of the language. Once they see that you're speaking to them in Spanish, that wall comes down, because they're going to be afraid of the fact of saying something wrong or making an assumption that you don't understand them because they speak a different language than you. But I think the issue of that first word of hola, ¿cómo estás? And the walls come down, and they feel like, well, this is a welcoming environment, and I know that in the process I'll be able to talk about how I'm feeling. Don't get me wrong, we have clients that in the first session they can come and say everything, and then we have the ones that have difficulty to open themselves. But I think the environment at the clinics that we have in the community, they tend to be that sense of communal, the sense of you feeling that you belong and that we're here to help you.
Absolutely, and there's always something about the name too, that's something that they can relate to, just coming in and seeing the office hours that they're both in English and Spanish, for example, being able to read the documents in their native language. So those little things, de hola, de buenos días, de cómo está, pase adelante, cómo le puedo ayudar, little things, but those little things are huge when it comes to engaging the community and being able to serve them.
If somebody's watching right now and they have some hesitation or some shame to seek help or assistance, what advice would you give to them?
If they think that they need help, go ahead and look for it, because again, it's better for you to seek the help that you might need and feel comfortable than not seek for it and the situation, kind of escalating and then not being capable of talking about what's going on. So in my perspective, and I think also with my colleague here, I think that if anyone needs a matter in terms of talk to somebody related about how they're feeling, just go ahead and do it. That's why we're here in the community, in order for you to feel comfortable, in order for you to be accepted, and in order for you to deal with what you're going through.
Exactly. It's like when we first started talking, mental health doesn't discriminate. We all go through different things. We all go through things that are challenging and that impact us in different ways. So knowing that nobody's exempt, we can all go through these things, and there's always somebody there to help you. Just walking in and then seeking that help. Absolutely, that's all that we can say, and that's I think the most important thing.
Thank you both for joining me here.
Thank you.
As the Latino population continues to grow, so does the need for more professionals in mental health services who can relate to individuals on a cultural and linguistic level, which can help eliminate any stigma or barriers that exist, making more individuals feel comfortable in seeking help. Stay tuned for more on Presencia.
¿Quieres conocer más de los latinos en Nueva Inglaterra? Te invito a visitar nuestra página de la web wgby.org/presencia. Haz un clic para que conozcas sobre nuestra herencia, tradiciones, cultura, diversidad y más. Queremos que tu voz sea escuchada.